Hello, I'm Rob Bacon, the Sexual Health Improvement Lead for Public Health Hertfordshire, and I'm going to give you an overview of the data that was collected regarding sexual health and drugs and alcohol from the Young People's Health and Wellbeing Survey. The survey was undertaken in November-December 2020, just prior to the most recent lockdown. COVID has meant that a number of services have had to operate differently and in some cases have reduced. Young people's habits will also have been impacted due to previous lockdowns, and we have to consider that because it may have changed people's behaviour. If you are looking for some basic information of local services across the county, Health in Hearts is a really good place, lots of different topics to do with health. Sexual health and drugs and alcohol have their own specific sections, but there's also the national websites as well. So Sexwise for sexual health, Talk to Frank for drugs and alcohol. Again, containing loads of good information and a really good starting point if you need any further support. Here are some other links for further information. For drugs and alcohol, CGL is our local provider. For sexual health, it's Sexual Health Hertfordshire. Services for young people also provide support through their access points, and they now have the texting service where young people can text a question and a youth worker will get in touch with them. And they can also order free condoms through that site as well. The data here shows that 41% of young people feel that there's pressure on other young people to have sex, and that has increased in Year 10 pupils since the last survey. And those perceptions do increase by age and are more pronounced in girls than boys. But a really key element here, and a really good message to get across to young people, especially around boundaries and consent and feeling good about healthy relationships, is that 90% of Year 10 pupils in Hertfordshire feel that it's okay to wait. Also, it's important to remember that faith and ethnicity can also influence attitudes around sex and relationships. Where young people access sex and relationship information is going to determine the accuracy and the quality of that information. So it's good to see that schools is a key source for young people. We also can see here that young people understand that a health professional in some capacity can provide support on contraception, testing for sexually transmitted infections, whether it be a doctor, a sexual health clinic, or a pharmacy. Although 35% of boys think that most 16-year-olds have not had sex, that does leave a high percentage to think that majority of young people are having sex. And we do know that that's not actually true. So before undertaking any sex and relationship education, it's really good to have an accurate baseline. And also remembering the previous slides that the majority of young people think it's okay to wait. What is also positive here, both in young men and in young women, is that they understand the importance of condom as a method to prevent sexually transmitted infections and unplanned pregnancies. And the websites on the previous slides give information about condom use and also the condom demonstrations. We can see here that knowledge increases with age when it comes to how to access contraception and sexual health services. And that's really important. It's good to see that Year 10's knowledge has improved over since the previous survey. But this information needs to be consistent throughout their school journey, but also when they leave school and then into college, university and the workplace, as this is when you're more likely to have your first sexual experience. Now we move on to smoking. So majority of young people in Hertfordshire, 90% have never smoked. Got a very small percentage of young people who smoke on a regular basis. When we look at vaping, more young people are vaping than they are smoking. And we do see a percentage that have tried it but no longer do so. So probably more so on an experimental basis. So if we have a look at this in more detail, you can see there are certain patterns here with heart smear where young people were less likely than the wider sample to have never smoked or vaped. And more positively, young people identifying Asian were less likely than the wider sample to have smoked and vaped. But there are differences between the Black and Chinese groups where they both were more likely to have smoked and vaped, with Black smokers wanting to carry on smoking. So it's an area where here is the message need to be targeted slightly differently towards those two groups if we were talking about how to give up, when to give up, and what support's available. So now we move on to other drugs, and similar to sexual health, depending on where young people access their information from, will determine how the quality and the accuracy of that information. It's important that all those sources where young people do turn to, make sure they know what the local services are and how to refer. But positively, 91% of young people have never taken any drugs. And when it has been reported that they are, cannabis is still the most commonly used substance, and that's similar to patterns across the UK. We have started to see increases in other drugs, ecstasy, cocaine, ketamine, but it's difficult to draw any conclusions because we know drug use increases by age, and older children have been included in this year's survey. If you're unfamiliar with any of these drugs, please make sure that you access the Frank website for further information. You can also see here the different places where young people obtain drugs, with school being the less likely. When we look at this in more detail, we can see that both gender and ethnicity can play a significant part in how and where young people access information if they had any concerns about drugs. You can also see here, similar to smoking and vaping, that HeartSmear has been highlighted as a particular area where more drugs were taken by young people in the last 3 months than any other areas. And actually, even though relatively small numbers, other drugs like heroin, steroids and psychoactive substances have been highlighted. So now we move on to alcohol, with the majority of young people, 72%, not having an alcoholic drink in the last 3 months. Do need to bear in mind there were some forms of lockdown restrictions prior to the survey, so access to alcohol might have been more difficult, especially if young people were more likely to be in the home. Of those who do drink, though, 67% would like to keep drinking, with a smaller percentage wanting to support to give up. But frequency and the amount of drinking amongst young people who do drink is relatively low. So 39% not drinking alcohol on most typical days, and 55% never binge drinking. The most common places where young people obtain alcohol were home or friends and relatives, and we do know that alcohol consumption, which is supervised, is less likely to result in any sort of high risk behaviours or binge drinking. So as we move on to looking in this in more detail, you can see again similar patterns in the HeartSmear area, with students responding with never when asked how often they had an alcoholic drink in the past 3 months was significantly lower than all the other areas. And also with the Chinese or black young people, who were more likely to binge drink on a daily basis compared to the wider sample. And again, if you remember, their smoking behaviour and vaping behaviour was also was higher. So is there particular high risk behaviours within this particular group that need to be addressed? Now, my final slide, just a reminder of the links to the local websites, which lists the various organisations that are available across the county. Please make sure you become familiar with these, click on the links, find out more information and what's available in your area. Thank you.